Welcome, everybody. I'm Frank. I'm the program manager for the Staten Island COAD. I'm about to share my screen in just a second here, but just wanted to welcome everybody as we're letting you all in, and thank you for joining us. Okay, can everybody see my PowerPoint slides? Okay.
Can.
Yes, Frank.
Thanks. So once again, just thank you everybody for joining us. Again, I'm Frank, I'm the program manager for the Staten Island COAD. The Staten Island Not-for-Profit Association and Staten Island COAD are hosting this town hall. So we thank you. We just wanted to get as much information about the vaccines as possible. And we're gonna keep letting a few people in. Let's see, we'll keep going, rolling along here. And Sharmila and Linda, if you don't mind just admitting people as we keep going. Just a few things to cover as we get started. You know, some Zoom etiquette. First and foremost, I want to let everybody know that we're going to be recording this session. So if you don't want to be captured, please turn off your video. We are also using a transcript capturing service called Otter AI that is going to capture everything that people are speaking and putting it into a transcript. So the video and transcript is actually going to be sent to all of our registrants post session. So in case you don't want to be recorded, please, you can take yourself off video. And also I'd like to remind everybody, just basic Zoom etiquette, mute your mic, feel free to drop your name and your organization in the chat box, remove all distractions. You know, we know it's tempting to have your phone at your side, and get cozy. We're going to be here for an hour and a half. You know, grab a beverage, grab some note-taking gear, and also just want to thank everybody for their patience as we're getting through this process and doing everything virtually. So just some basic practices at the start of this. You know, I introduced myself. If you are a speaker, you know, our guest speakers know this, but just say your name and organization. I'll do my best to intro everybody as well. If you are sharing graphics just for accessibility purposes, please describe them, what's on the screen. One person, one mic rule. You know, let's respect our guest speakers. And as this is a town hall, if people do have questions as our speakers are presenting, please drop your questions in the chat box. Someone from the COAD or CINFPA staff will facilitate those questions. Move up and move back, know when to speak up and listen to others and give others a chance. And then also literacy moments. If there's something that's confusing, feel free to ask for clarifications. Other things that, you know, I think we're all pretty familiar with, but just to cover, there's the mute button and the stop video button on the bottom left-hand corner. You can check out the participants by clicking that button and view the chat box by clicking the chat box button. Lastly, I made mention of our transcript capturing services, but we also have closed captions available at the bottom right-hand corner. So you'll see that on the bottom menu. How to raise your hand, you know, for the most part, we'll be facilitating questions through the chat box, but if somebody feels like they can't use the chat box for some reason, please feel free to raise your hand and we'll be able to call on you for questions. And last but not least, you know, just different viewing options. So you can click the view button there and be able to view those in case you find one of the views more comfortable for yourself. And I'm just gonna go over today's agenda. Actually, you know what, before we go over today's agenda, I'm gonna introduce our Executive Director of CINFPA, Sharmila Rao Tucker, and she's gonna talk a little bit about our organization and what we do. Oops, Sharmila, you're on mute.
Thank you, Frank. 11 months into this, you'd think I'd have it down pat. Good morning, everyone. I'm Sharmila, and I am so excited to have so many of you here today to hear from our esteemed panelists on the COVID-19 vaccine. Just a little bit about the Staten Island Not-for-Profit Association. It was formed in 2005 to help really build the capacity of our nonprofit sector on Staten Island. We work with and serve as a membership organization our community-based groups in all sectors, so arts and culture, healthcare, human services, social services, youth, elderly, and we're so excited to have so many of our members on the call today and so many of our leaders. After Hurricane Superstorm Sandy, actually, we started the Staten Island Community Organizations Active in Disaster, SI-COAD, which you'll hear referenced a lot today. And a subset of that work or that coalition is the medical ecosystem. We do a lot to build the capacity of our nonprofits to be prepared and ready to respond to any crisis, emergency, or disaster in Staten Island. Over the years, they've been mostly weather related. However, as you know, through the last year, we've been dealing with the COVID-19 pandemic. We have worked in close partnership with the Office of the Staten Island Borough President, many of our nonprofits on the phone today, as well as the Staten Island Long-Term Recovery Organization, New York City Emergency Management, and New York City Department of Health to get a sense of what the needs of Staten Islanders are regarding COVID-19. And through our leadership, who are all on this call today, some of whom you'll hear from, we have been able to advocate for Staten Island, both your voices and our organization's voices, to get what we need in terms of resources, supplies, staffing, and space. We continue to work hard in partnership with all of our partners across the city to continue to hear what you need. So we are here for you, and we're grateful specifically to our funders, including Staten Island Foundation, New York City Department of Health and Mental Hygiene, and Con Edison, as well as several others that have really enabled us to stay strong and keep you all safe and informed during the last year. With that, I turn it back over to Frank to get us started.
Thanks so much, Sharmila. So just a quick overview of our agenda. Most of you have seen this, or all of you hopefully have seen this on our flyers that have gone out over the last week. But just we'll have some opening remarks from the office of Charles Fall, our New York State Assemblyman in District 61. We'll also be having our first presenter, Dr. Jennifer Rosen, give a presentation on vaccine equity, development, and monitoring, just alleviating concerns around the vaccine in general. She's the director of vaccine hesitancy and COVID-19 response at New York City Department of Health and Mental Hygiene. We'll also have some local outreach efforts, some local Staten Island outreach efforts comments from La Colmena and the Community Health Organization of Staten Island. I'll be presenting just briefly on our Staten Island Stay Strong, Stay Safe campaign. It's a public messaging campaign on the core 4 and making sure that everyone gets vaccinated. And then we'll have some spotlights on people's experiences with different community members' experiences with the vaccine, as well as Q&A at the end with Dr. Ginny Mantello and Trientina Campbell. As well, I believe Dr. Ginny has something prepared for us to present at the end. So without further ado, I'm going to get going. Sitanji, are you on the call?
Hi, good morning. Yes, I'm here.
Hi. Okay, I'm going to let you go ahead, and I think I'll stop sharing my screen and let you get going.
Okay. Good morning, everyone. I hope everyone on the call is in good health and good spirits. I know it's been a long couple of, almost a year now, challenging year for our community. Unfortunately, we've lost many lives to this pandemic. So, hope is on the horizon now with this COVID vaccine. And with the distribution plan centered on fair and equitable rollout, our office, the Office of Assemblyman Fall, is really excited to be here with you all this morning. Unfortunately, the Assemblyman is in Albany, and so there was some last minute meetings that came up. So I'm glad that I could be here in his absence, but he wishes he could be here to join you all. To date, the city has reported that there's over 800,000 vaccines that have been administered to in New York City, and that's a truly remarkable achievement. However, millions of eligible and willing New Yorkers are still without the vaccine, and so for our office and the Assemblyman Fall, we've been staying up to date with the federal government and learning that New York State receives approximately 250,000 vaccines per week, and though we have about 7 million people who are currently eligible for the vaccine. So there's a lot of work to be done to ramp up the vaccine production and get it to our communities. And so as a result, many of you are probably aware that vaccine supplies have also been extremely limited, and we're witnessing shortages citywide. But for Assemblyman Fall and his state and city colleagues, they're urging the federal government to support the efforts to increase the vaccine production to match our needs. Over the last few months, our office has been working pretty closely with the governor's team and advocating to the city to ensure that the vaccine appointments are accessible to our communities that have been disproportionately impacted by the pandemic. As the representative for the North Shore, the Assemblyman has been very keen to knowing that, many Black and Brown communities on the North Shore have been significantly impacted by the negative effects of COVID. And so that is important to incorporate into how we look at the distribution of the vaccine itself. We've also been proactive in connecting with seniors interested in taking the vaccine, as those who are 65 and older are now eligible for the vaccine. So some of you on the call may have received a robocall from the Assemblyman a few weeks ago, and hopefully that was informative about where and how you can get the vaccine. And if anyone on the call today knows a senior or is a senior and is, needs assistance with making an appointment, we are here to help, and please reach out to us. I'll put my contact in the chat box after. Assemblyman Fall has also been recently introduced a bill with his colleague, Senator Granardis, to ensure that public workers are provided with 4 hours of guaranteed time off to get vaccinated if they choose to. And it's really important to make sure that those who are on the front lines and our public workers, as they expand the vaccine eligibility, get access to the vaccine and don't have to compromise their work hours, don't have to compromise in being accessible, having some accessibility to the vaccine. But most importantly, we want to continue to establish sites in our neighborhoods that are accessible by public transportation, have extensive hours of operation, and that we continue to work as a community to spread facts about the safety of the vaccine. Many community members, understandably so, may be fearful of taking the vaccine. So events like this are crucial because they help to build our trust and share accurate information about how we are all safer as more people are vaccinated. And I'll just close by saying that we're encouraging everyone to continue getting tested for COVID to limit the community spread and to keep our community safe as we await more vaccines. And to find more free vaccines near you, to continue looking to nyc.gov/COVID test, and to make vaccine appointments when you're eligible, to go to vaccinefinder.nyc.gov. Because getting the hands into the vaccines of everyone who wants it will require us all to continue playing our individual part to spread accurate information on how and where to do so. So I thank you to the Staten Island Not-for-Profit Association and Staten Island Community Organizations Active in Disaster for this invitation. And we are eager to work with more of the nonprofits that are on this call today and one of the organizations doing the work in the district, whether it's COVID or not related, to please reach out to us so that we can exchange information and continue this community work together. And while unfortunately I'm not able to stay on for the remainder of the discussion, I will put my contact in the chat box for you all, and just mention that Thursday, the February 4th at 6 p.m. we'll be hosting, Assemblyman Fall will be hosting a town hall where you can bring forth any questions that maybe you wanted to pose to him today, or things that are non-related to COVID. I'll put the link for that as well in the chat, if that's okay, so that you can register after this event. Please don't get distracted and do that while everyone else is presenting, but please do open that link and then send that, and I will end there.
Thank you so much, Satanji. That's great information, and those are great resources. I know that Thursday town hall is also going to be a great resource for people who have questions. Once again, this is Satanji, Chief of Staff for Assemblyman Charles Fall. And thank you so much for your time and for joining us. Without further ado, I'm going to turn it over to Dr. Jennifer Rosen, and she's going to present with just alleviating some of the concerns around the vaccine. So, oh, it looks like she was kicked out, so I'll readmit her. Dr. Rosen, are you with us?
Yeah, sorry about that. I think with the weather, I was having some connection problems.
No worries, it's fierce out there. And also thank you everybody for joining us during this winter storm. Dr. Rosen, are you able to share your slides?
Yes, here I go. Okay, can you see my screen?
Yes, perfect.
Great, okay. Okay. So thanks so much for having me here today. I'm going to give an overview of COVID vaccines, and then I will have time for questions after. Just to start, I'd like to review some key messages about the COVID vaccines, and then I will go into all of this in more detail. But COVID vaccines are safe and effective, and they're available to New Yorkers at no cost. COVID vaccines are available to people of all immigration statuses, and vaccination is not a public benefit under the public charge rule. And when people are vaccinated, their privacy will be protected. And just remember that vaccines alone do not prevent disease. People getting vaccinated prevents disease and saves lives. Now I'm going to talk about vaccine development and monitoring. We get a lot of questions about vaccine safety. People understandably have a lot of concerns about vaccine safety since these are new vaccines. And many people don't understand how vaccines could have been developed so quickly without compromising safety. So I'm going to talk about that now. There are 4 phases of vaccine clinical trials, and each phase studies whether the vaccine works and is safe. Phase 1 trials include a small number of people, usually less than 100 people, and then the studies move on to phase 2, which typically includes several hundred people. At that point, the phase 3 trials are expanded to include thousands of people, some of whom received the vaccine and some of whom received no vaccine or a placebo. And ideally, the phase 3 trials include representation of people who will actually receive the vaccine in the general population. Vaccines must be reviewed and authorized by the US FDA before they can be used. And the FDA monitors vaccine development from beginning to end, and they analyze clinical trial data to decide whether to allow the vaccine to be used. They then continue to monitor vaccine safety data even after the vaccine is approved. And we also get a lot of questions about what exactly is an emergency use authorization or an EUA. So in an emergency like COVID-19, the FDA may allow vaccines to be used before they are officially licensed by issuing an emergency use authorization. And that's so that we can use the vaccines right away. No shortcuts in the testing of the vaccines are allowed, and all vaccines issued an EUA need to go through the same trials as other vaccines. An EUA can be issued only if the evidence strongly suggests that the benefits outweigh any risks to patients. Safety monitoring is done extensively by several federal agencies and external organizations throughout the trials and as part of ongoing evaluations even after the vaccines are approved. Now I'll talk about the COVID vaccines. So how were these vaccines developed so quickly? Well, we were not starting from scratch. Scientists built on many years of research from other vaccines, including research on vaccines for other coronaviruses. And the federal government spent billions of dollars to allow for the development, testing, and production of the vaccine all to happen at the same time. So, for example, during the clinical trials, when the companies were trying to determine whether the vaccines worked and whether they were safe, they were also producing the vaccine at the same time. Normally, this would never happen because it's incredibly expensive to make the vaccines. So under normal circumstances, companies would have to wait and see if the vaccines work and if they will get approved before they even begin to make the vaccines. But in this case, they had the money and the support to be able to do this concurrently. Also, the government, health departments, and healthcare providers had been working for months to plan for storage, distribution, supplies, and other logistics so that as soon as a vaccine was authorized for use, we could hit the ground running and begin vaccinating people. 2 vaccines have been authorized by the FDA for use and are currently available in New York City, and that includes the Pfizer mRNA vaccine and the Moderna mRNA vaccine. There are other vaccines in various stages of testing, and over time we will learn more to find out if they become approved. So what is an mRNA vaccine? Well, mRNA or messenger RNA vaccines contain genetic material from the COVID virus, but they do not contain the actual virus. And although mRNA is a new type of vaccine, it had actually been studied for over 30 years for other types of vaccines. And here's how they work. The mRNA enters the body with instructions on how to make a protein that is part of the virus that causes COVID-19. The body makes the proteins, and these proteins cause the body to make antibodies and other defenses. The mRNA is then broken down and destroyed by the body. It does not stay in your body, and it does not interact with a person's own DNA. Then later, if a person is exposed to the virus that causes COVID-19, the body recognizes it and makes antibodies to fight it. Both Pfizer and Moderna vaccines were shown to be incredibly effective and safe across all gender, age, race, and ethnic groups. Both vaccines prevented sickness or severe COVID-19 in over 94% of study volunteers. This is incredible, and for reference, the FDA only requires a vaccine to be 50% effective in order to be approved. And this is way above that. And in fact, these are among the most effective vaccines that we have for any disease. Both vaccines require 2 doses, and both can cause mild to moderate side effects. Both in the phase 3 trials, both had over 30,000 people included in the trials, with good representation of people aged 65 and older and across various race and ethnic groups. The Pfizer vaccine is approved for people aged 16 years and older, and Moderna for aged 18 years and older. We know a lot about these vaccines, but there are still things that we don't know, including how long protection from the vaccine will last. So we know that the vaccine protection will last at least a few months, but we need more time to see if it lasts longer than that. So we don't know yet, will this be more like flu, where you need an annual a dose each year, or like tetanus, where you need booster doses every few years, or not. We also don't know whether the vaccine is safe and effective for children. We don't know that yet because the vaccine trials did not include children younger than age 16. Those trials are being done now, and we hope that there will be a vaccine for children in the future. We also don't know whether being vaccinated we know that the vaccine is incredibly good at preventing symptoms of COVID and preventing hospitalization and death. What we don't know is whether it also protects against infection in people who have no symptoms. So until we know that, we won't know whether the vaccine prevents people from spreading the virus to other people. Probably most people know that currently eligible groups for vaccine include healthcare workers, people aged 65 and older, residents and staff in nursing homes, homeless shelters, and certain other group living facilities, and certain frontline essential workers like first responders, teachers, school staff, transit workers, and grocery store workers. The eligibility groups is determined by New York State, and this is based on guidance from the CDC. And overall, these eligible groups prioritize people who are either at increased risk for getting COVID or who are at increased risk for severe COVID illness. Over time, additional groups will be added, and the phase distribution will take time. We do not expect that vaccines will be widely available to everyone until probably mid-2021. The eligibility groups are changing rapidly, so please see our website for the most current list of eligible groups. There's strong evidence that vaccines are safe and effective. The vaccines protect you from COVID-19, which, as we all know, can have serious health consequences, and people of all ages have been hospitalized and died. Even people who recover may have continued health problems for the longer term after the initial infection resolves. And the vaccine also can protect people around you. Also, the vaccine will help us move closer to ending the COVID-19 public health emergency and getting New York City back on its feet. So who can and cannot be vaccinated? Well, children less than 16 years of age cannot yet be vaccinated. We need studies to be done in this age group. For some groups, like pregnant people and people who are breastfeeding, there is limited information about the safety and effectiveness of the vaccines. However, these groups can still choose to be vaccinated. You can speak with your healthcare provider if you have questions about whether the vaccine is the right choice for you. And the reason why there's limited information in these groups is because pregnant and breastfeeding people were not intended to be included in the clinical trials. There are many places where you can get vaccinated. In some cases, people can get vaccinated at their workplace. For example, if you're a healthcare worker, there are city-run sites in all 5 boroughs. Healthcare facilities and pharmacies are vaccinating. But the best place to go is the city nyc.gov/vaccine finder to find a vaccine site near you and to make an appointment. In order to get the vaccine, first check the website to make sure you're eligible. You can make the appointment, and you'll need to complete a New York State vaccine form. When you go, bring proof of your eligibility and wear a face covering. And don't forget to make an appointment for your 2nd dose. And this is a screenshot of our vaccine finder site, and you type in an address, zip code, or search near me to find the nearby locations. And just be aware that each vaccine site manages their own schedules and appointments. The locator provides links and phone numbers for you to schedule the appointment at each location. And appointment availability is really dependent on vaccine supply. Unfortunately, the supply is still limited at this time. Make sure you get the 2nd dose. The vaccine offers some protection after the 1st dose, but protects you more after the 2nd dose. And the vaccine is the most protection from the vaccine occurs 1 to 2 weeks after the 2nd dose. The 1st and 2nd dose should both be from the same vaccine type. So for example, if you get Pfizer for the 1st dose, the 2nd dose should be Pfizer. Schedule your 2nd dose at the time that you get your 1st dose. So the timing depends on which vaccine type you're getting. So if you're getting Pfizer vaccine, you should get your 2nd dose at 21 to 42 days after the 1st dose. And for Moderna, you should get it at 28 to 42 days after your 1st dose. When you get vaccinated, you will get proof of vaccination cards, and bring that card with you when you go for your 2nd shot. Most people report some side effects from the vaccines, which are usually normal signs that your body is building protection. Common side effects include soreness or swelling on the arm where you got the shot, headache, body aches, tiredness, and fever. Side effects are usually mild to moderate and usually start within the first 3 days after getting the shot. They usually last for about 1 to 2 days after the symptoms begin, and for these mRNA vaccines, the symptoms are more common after the 2nd dose. They're also less common in older adults. Call your healthcare provider if you have side effects that concern you or do not go away after a few days, or if the redness or soreness where you got the shot increases after 24 hours. Talk to your provider about taking an over-the-counter medicine like Tylenol or Advil to relieve pain or discomfort if you develop these symptoms. And get the 2nd shot, even if you have mild to moderate side effects after the 1st shot, unless your healthcare provider tells you not to. Allergic reactions to the vaccines are uncommon. Talk to your healthcare provider before getting vaccinated if you have ever had an allergic reaction to a vaccine or injectable medicine, or if you are allergic to any ingredient in a COVID vaccine. Other types of allergies, like to food, pets, dust, pollen, latex, those are not a concern for vaccination. Allergic reactions usually start within minutes to an hour of getting the shot and may include difficulty breathing, swelling of your face and throat, a fast heartbeat, and a bad rash all over your body, dizziness, and weakness. If you think you're having a severe allergic reaction, call 911 or go to the nearest hospital. After vaccination, you still need to practice the core prevention measures, including staying home if you're sick, keeping 6 feet distance from others, wearing a face covering, and washing your hands often. And this is because, like all vaccines, no vaccines are 100% effective. And we still need to learn more about how long protection from the vaccine lasts and the impact of the vaccine on disease transmission. And we will update our guidance if and when we can begin to ease prevention measures. And I also wanted to add, take care of your mental health. This is an incredibly stressful time for everybody. and there are 24/7 resources. If you need to speak with a counselor, you can call 1-888-NYC-WELL, or you can go to our website, nyc.gov/NYC-WELL, to speak with a counselor 24/7. Thank you.
Thank you, Dr. Rosen. So we're gonna start going through the chat box and just bringing up some of the questions. And just thank you for such a great informative presentation. Let me go here and see what we've got. So just starting from the top down. George asks, any updates about the effectiveness of vaccines with the new variants of the virus?
There's still research underway. It's expected that these mRNA vaccines will provide protection against the new variants, but whether the protection is as high or not still is to be determined.
I see Elaine has a question there about getting an appointment, but I think that's been addressed in the chat box and during your presentation. Priscilla asks, I'm looking for a speaker for my civic association meeting on March 2nd. I was able to get 2 of my members who are seniors to get the vaccine at Port Richmond High School yesterday, but there was a struggle to get them on the list. Is there any better way to get eligible seniors appointments? I literally saw a message on Facebook and contacted someone from Project Hospitality. While we were ultimately successful, there has to be a better way to do this. Also, seniors who may not be mobile, how are we addressing this? I think also I should add, now is a good time for me to mention that any local questions can also be fielded by Dr. Ginny and Tina, who are joining us.
So I can start, and then please add on. We know that there have been a lot of challenges with making appointments, and the city is making a lot of effort to try to streamline the process and make it easier. We also know that there are community organizations that are helping people, seniors, for example, who to help them to make appointments because it can be challenging. In terms of people who are homebound, the city is also working on initiatives to try to help people who are homebound get accommodations to get vaccinated. The challenge is that the current vaccines, the mRNA vaccines, are not very stable at room temperature, and they require special storage, so it's not as easy to bring them from place to place as it is with some of our other vaccines like the flu vaccine.
We have another question from Bob and Lois. How will it be determined that immunity is continuing once vaccinated? For example, blood testing to determine if antibodies exist?
So as part of the clinical trials, people are being followed over time to see how long protection is lasting, but that's as part of the research trials. And so individual people like yourself, if you get vaccinated, there's no testing that needs to be done.
I have another question. This was actually submitted upon registration. I have read that you need to wait 3 months to get the vaccine after having COVID-19. What if you unknowingly have asymptomatic COVID-19 when you get the vaccine? I haven't heard anyone answer this question.
Sure, that's a great question. You do not have to wait any particular amount of time between having the infection and getting vaccinated, except that if you know that you're sick with COVID, then of course you need to wait till your symptoms improve and until you're no longer contagious. So when people have COVID, they're told to stay home for a certain amount of time, which is their isolation period. You have to stay home during that time because we don't want you to be contagious when you go to the vaccine site and expose other people. What you may have been hearing is that people are we know that people can be reinfected. They can have infection with COVID more than once. However, you're less likely to become reinfected during the first 90 days after your infection. There is probably some protection during that period. So some people may choose to wait 90 days when their risk for reinfection is greater, but you do not have to wait any period of time.
Excellent. We have another couple of questions actually about specific groups and the vaccine. So one is, how do we alleviate the fears and concerns about the vaccine within the Black and Brown communities?
Thanks for that question. So the approach that we are taking for all communities is to be very transparent with what we know and what we don't know. There's a lot that's known, but there are still questions. For example, how long does immunity last? And we also want to make sure that people know that the vaccines were tested in tens of thousands of people and with diverse representation of all different patients, including racial and ethnic diversity. And the vaccines, very importantly, the vaccines were found to be consistently safe and effective across all racial and ethnic groups. But we also need to acknowledge that there are very valid reasons for mistrust among people of color and in any group really. And so we have to be very transparent about that and recognize historical racism that has occurred.
Thank you, Dr. Rosen. And another group being addressed, are there plans for a youth-focused messaging around the COVID positivity rates affecting more youth than before?
There's definitely work being done by the city and by the health department to work with communities that are most impacted by COVID and for example, increasing rates among younger adults. Definitely, thank you.
Mm-hmm. We have another question from John here. And thank you for the rapid fire responses here. I'm part of the group that suffers from severe allergies. When do you estimate that my group will be able to get vaccinated, and are they still recommending a hospital setting?
So it depends on what your allergies are too. So people who have had serious allergic reactions to the COVID vaccine, if you've received your first dose, if you've had an immediate allergic reaction or a serious allergic reaction after the first dose, or to its components, one of which includes something called polyethylene glycol, which is something that's found in other medications, for example, or polysorbate. Generally, you should not be getting the second dose of the vaccine. Otherwise, if you've had serious allergic reactions like anaphylaxis to vaccines or injectable medications, you'll need to talk with your provider to see if whether they feel it's safe for you to get the vaccine. For anybody else who has had allergic reactions to anything else, you can get the vaccine. What will happen is you should tell the person giving you the vaccine what your allergic reactions were to in the past, and that will determine how long they will observe you after getting the vaccine. So everybody is observed for 15 minutes, but certain people, for example, people who have had anaphylaxis or serious allergic reactions in the past will be observed for a longer period of time, typically 30 minutes after.
Excellent. I have another one, and I believe this one might be for Dr. Ginny. Is there a way to confirm which vaccine I will get? I may have a reaction to something in Moderna. Oh, you're muted, Dr. Ginny.
I unmuted. Can you hear me?
Yes.
Okay, great. Thank you. The community sites, for most part, are offering the Moderna vaccine. As Dr. Rosen pointed out, the vaccines are fragile. Pfizer, in particular, needs to be refrigerated at very low temperatures, like -70 to -90 degrees. And it's difficult to offer that out in the community. That being said, the hospitals are offering both Pfizer and Moderna. And the state has also worked with our community to do a few pop-up sites for seniors, at which point they have brought the Pfizer vaccine. But all the city hubs and the federally qualified health centers, the urgent care centers, and others in our community that are offering the vaccine on a regular basis outside of the hospitals are offering Moderna at this time. If you know for sure that you have an allergy, a severe allergy to a something in the Moderna vaccine, you can work with the local hospitals. Richmond University Medical Center in particular has been offering to the community, and you can put your name down on the list for that vaccine.
Hi, this is Tina Campbell from Richmond University Medical Center. Just a bit of clarification. To be honest with you, we don't actually know until last minute what vaccines we have available. And it does seem to be that they will more provide us with Pfizer vaccines, mainly because the hospitals do have the -70 degrees freezer to actually accommodate for that. So obviously most of the other sites that are not hospital don't have those capabilities, and they will more likely give them the Moderna. But for us, we have only gotten Moderna once during the entire allocation process. Majority of the time, what we are getting is actually Pfizer, and we have tried to get both. But again, what they can only do it based on availability. And because Moderna seems to be more frequently being asked from other sites, and we have the capability for the -70, they would prefer to give us the Pfizer.
I do want to add two more things. One is that the pharmacies have, like CVS and Walgreens, have been also giving Pfizer, but right now they're limited to offering these vaccines only to the nursing homes and adult care facilities. I did put in the chat, everybody needs to be patient. We have Johnson & Johnson submitting for EUA very soon. We should hopefully have another vaccine in the market, which can be refrigerated and doesn't require extreme temperatures. Also, the federal government, of course, has been working on increasing the supply, and already I think that for the next 3 weeks to come, starting this week, we're supposed to go up to, Jennifer, correct me if I'm wrong, from 250 to 290,000 doses for the state per week, and our allocation was 250,000 up until last week, and now it's supposed to go up by another 40,000. So I know everybody's frustrated. There's a lot more people who want the vaccine than the amount of vaccine we have. But everybody is trying really hard to try to work on getting more vaccines, and B, trying to make the process a little bit more seamless. And we are giving feedback to the health department, constantly. We talk to them all the time. And, between Tina and I, we probably talk to them daily. And so any feedback that you have, please send it to us, and we'll be sure to send it over to them.
And just to add to that, Ginny, and I did see a couple questions come up in the chat as well. Scheduling is very difficult, and it's not just on Staten Island, it's across the board, it's across the country itself. What the states have required us to do from a scheduling perspective is that we can only schedule we can only schedule if we have vaccine present on site. With that being said, we also have the requirement that we have to use up the allotments that we get each week, or whenever we get the allotment, it has to be used within a 7-day period. So once we've actually used up that allotment within that week, we will not schedule anyone for the previous week. So we have been allowing people to call 718-818-3193, and I will put it in the chat as well. And that is the scheduling. But once we know that we have scheduled people for the allotment that we have received, we turn off that answering machine so that we won't constantly get messages, because it's very overwhelming and tedious for us to keep track. But if we get a message from you, you're actually placed into the allotment. And once we're able to do it, it's really a first come, first serve. We're not actually trying to push someone ahead. We're just going through the process of making it as fair as possible and try to cover as many people as possible. And yes, we know it has been chaotic. It has been stressful, but we're trying our best to see how best Richmond, as an independent hospital, can really support the community in trying to vaccinate as many as possible that are on that priority list.
Thank you, Tina, and thank you, Dr. Ginny, for those answers and great information specifically about scheduling there. Dr. Rosen, I think this is going to be a great clarifying question. Friend gets severe reaction to antibiotics. Should she get it?
Having reactions to antibiotics is not a contraindication and not a precaution to getting the COVID vaccine. So yes, they can go ahead and get the vaccine. Again, if the reactions have been severe, like anaphylaxis, the vaccinator may tell you to stay for an additional amount of time after vaccination, just so that you can be observed, probably for 30 minutes. But yes, you can and should still go ahead and get the vaccine.
Excellent. And another question, is the vaccine safe for people with autoimmune disease, such as systemic lupus?
The vaccine, people with autoimmune diseases, and people, I'll just add, and people who have immunocompromising conditions can get the vaccine. That being said, there is limited data on vaccine safety and effectiveness in these groups, and that's because these populations, there's not information from the clinical trials on people with these conditions. The information is very limited. So that being said, people can go ahead and get the vaccine, but particularly for people who are immunocompromised, a big question is, will the vaccines work as well in people who have weakened immune systems? That we don't know yet.
Thank you. Let me make a few more questions. I have one specifically to bring up, but I know that as Sharmila and Linda have been monitoring the chat box, if you see something that's very pertinent, please feel free to bring that up next. If someone gets the vaccine, would they test positive on a subsequent COVID test? I've heard this asked a lot. Yeah,
that's a great question. People will not test positive for COVID after vaccination from the type of tests that are checking for infection. So when people get the nose swabs, that will not be positive as a result of the vaccination. The blood test, which is the test for antibodies, may come back positive.
Excellent. Thank you so much, Dr. Rosen. I know that we have a ton more questions, and we're going to do our best to make sure that those are all answered in the follow-up email to this town hall. We're going to move on now to our next presenter. We have the local Staten Island outreach efforts. Our first speaker will be Yesenia Mata. She's the executive director at La Colmena. Yesenia, are you here?
Hi, everyone. My name is Yesenia Mata. I am the executive director of La Colmena. And well, I'm just going to keep it real, and I'm just going to tell you exactly what has been happening with our immigrant community throughout this entire pandemic. When the pandemic began, La Colmena decided to keep its doors open because we knew in the very beginning that the immigrant community was going to be affected the most. And what we started seeing throughout that cycle, throughout this pandemic, we started seeing how the immigrant community kept being excluded from any type of relief, any type of support. And also we started seeing how the immigrant community started dying at a higher rate. You see, what do you do when certain elected officials are not doing enough, but your community is coming to your center saying, my loved one died. My father, who was a main source of income, passed away. We started just listening to this, and we said, we don't want this to continue. What do we do? When we started talking to the immigrant community to start figuring out what's really going on, we started doing our own investigation. And one of the things we started seeing and started hearing was that many of them were afraid to go and get COVID tested, or were afraid to even go to the hospital and were dying at home. And one of the reasons was because they were afraid that, one, ICE may be in the location, two, their information may be shared, but as well that if they may become a public charge. And we have seen how throughout this past year, they have been constantly targeted. So what we started doing was that we started then partnering up with NYC Health and Hospitals and the Department of Health. And we first started with the flu vaccines. We would be the outreach coordinator, and at the same time will be the person that will be in front talking to the community, because there's always an issue as well, language barrier. And as well, one of the other things is that the community feels most comfortable, and specifically the immigrant community feels more comfortable with people that they know and an organization that they know. So we started first doing conducted flu vaccines, and then that moved on to becoming COVID testing. So that is the same model that La Colmena right now is conducting, partnering up with NYC Health and Hospitals and the Department of Health, and us being the outreach source and bringing directly COVID testing to the immigrant community directly in front of La Colmena. So we hope that when the COVID vaccine becomes more available to the community, to the immigrant community, that they partner up with CBOs like La Colmena that have that trust with the community. But one of the things that even though that what we are seeing is that even though we're doing these efforts, and other organizations are too, other CBOs that work directly with the immigrant community, is that Black and Latino and Asians are still at a low rate having access to this vaccine. A report just came out that white individuals have gotten it at 48%, while Black and Latino and Asians have been lower than 15%. You see, this is what is happening, despite that the Black and Latino community have been dying at a higher rate throughout this pandemic. Right now, during this winter storm, day laborers, immigrant workers are in the front lines right now, helping the city of New York to get past this snowstorm. So I'm really glad as well that Charles Fall's office is here, because one of the things is that the immigrant community has been excluded, not just from any source of income, but as well right now, as we are seeing that vaccines are not really coming directly to the communities. We do hope that the Office of Charles Falls does fund the Excluded Workers Bill, and as well pushes for vaccines to come directly to the immigrant community, but as well to push all the assemblymen and like Mike Cusick, and as well to push State Senator Diane Savino and Andrew Lanza to ensure that immigrant workers obtain support and income, but as well that vaccines come directly to the immigrant community. And I say this because I don't want the immigrant community, the Black and Latino, to continue dying at a higher rate. And as we are seeing right now, right, the report shows how Black and Latinos are getting these vaccines at a lower rate compared to others. So, and I also just, if anyone on here would like to send over people to get COVID tested, just know that this Friday at La Colmena, we partner up with NYC Health and Hospitals to ensure that COVID testing is provided directly to the communities. And we're more than happy to partner up with other organizations to ensure that the immigrant community obtains COVID testing, and as well that the vaccine is being distributed properly to all communities. And thank you to all the people that are on here. I see so many people that work directly as well with La Colmena. Thank you for your service to the community of Staten Island.
Thank you so much, Yesenia. It can't be stated enough how important it is to our most vulnerable communities. So thank you for that message, and thank you for presenting. I'm going to turn it over next to our partners at CHASI. Eleni and Alexandra, are you here?
Yeah. Let me just share my screen.
Excellent. Thank you so much. And you're going to be presenting on logistics and scheduling, right?
Yeah, we're just going to be presenting, just sharing some of the work that we've been doing in different communities across Staten Island.
Excellent.
So, hello everyone. My name is Alexandra from CHASI, and I'm here with Eleni. And yeah, we're just going to be talking about the situation of the high number of cases of COVID in Staten Island's communities. So as you already know, Staten Island has an extremely high number of positive COVID test rates compared to other boroughs across New York City. So yeah, initially, Staten Island's positive test rate reached 4%, and that number spiked in January. And what we're really realizing is that a lot of the positive COVID test rates are concentrated in the South Shore and Mid-Island communities, particularly in these zip codes. And we're also finding that many cases are going undetected as well. So this is just a map that kind of visually shows where the positive COVID test rates are found. Yeah. So Chassie's solution to this problem has really just been addressing the situation real time. Initially, we were a T2 provider, but because of how many Staten Islanders we were able to reach in such a short period of time, we received a grant from NYC Health to become a Tier 1 provider, which really just means that we're able to expand our staff to nearly 20 people. We were able to distribute 250,000 masks to Staten Island residents, and we're also able to support other Tier 2 organizations in the work that they're doing to provide community members with information about COVID, and now to ensure that Staten Islanders are properly informed to make a decision about the COVID vaccine. Also, we just want to let everybody know that we'll soon be offering self-swab testing at our food pantry at 2134 Port Richmond Avenue. So here are photos of some of our team in action. So actually on the left side, we partnered with Colmena to disseminate COVID-related information. And on the right, you'll see that we're really here, rain or shine, and we're really committed to the work that we're doing to make sure that Staten Island's positive COVID test rates will be decreased. So our test and trace team is always looking for new community partnerships. So if you would like to host us for free PPE event where we're handing out masks or canvassing, or you want to talk about anything COVID related or vaccine related, you can give us a call on our helpline. This is the number. I'm sure Eleni will put it in the chat. Or you can email us at t2department@chassisny.org. Also, we just want to share some of the work that Chassis as an organization is still doing throughout this pandemic. So we're still able to offer at-home HIV testing. We have a food pantry that's still in Port Richmond that's open. And we also have a mobile pantry as well. If you want to know the times that our mobile pantries operates, you can just call us at 718-808-1450. And we're also able to offer recovery support and harm reduction services. And thank you. I'll hand it over to Eleni in case you have any questions.
Okay, so we're going to take this moment. We'll have a little bit of time for questions at the end in case anybody thinks of anything. The next thing we're going to move on to is actually our spotlight on some vaccine stories. So community members with different experiences receiving the vaccine. We have several community members. Sarah Bloss of SIPCW, Reverend Jackson is here from Project Hospitality and the LTRO, Long-Term Recovery Organization on Staten Island. We have Reverend Troya, also from Project Hospitality, as well as Reverend Carolina of Central Family Life Center, and Imam Zulkarnain Abdu Shahid of the Beit Ul Jamaat House of Community. Apologies for my pronunciation. But why don't we get started with Sarah, are you here?
Hello, Frank. Can you hear me okay?
Yes.
Wonderful. Thank you so much to you and the COAD for really putting this town hall together. It's more important than ever to be able to disseminate credible information and resources to the community. I'm just going to take a few minutes to talk about why I chose to get the vaccination, my personal experience with the vaccination, and why it's important to really not only protect ourselves as individuals, but our families and the larger community. So I'm just going to start with a little bit of really raw honesty. I was extremely apprehensive about receiving the COVID-19 vaccination. I identify as an African-American woman, and there has been horrific historical atrocities when we talk about the medical experimentation on Black women, on Black people in general, on the BIPOC community. And so, of course, whenever I go to receive any type of vaccination, I have doubts. I have a lot of mistrust. And again, all of that mistrust, people like to think about it in the lens of something that used to happen. It's exacerbated by housing conditions. It's exacerbated by the fact that many Black and Brown communities don't receive the resources that they need. That when we call our elected officials, when we call our clinicians, when we go into our hospitals, we're not treated fairly. So all of those things really, really make that mistrust much, much worse. And I have the privilege of working at SIPCW with our clinical team, really building that trust. And so I have access to credible information, and I can say, hey, what are the cost and benefit analysis for me receiving the vaccination as someone who's doing direct service work and as someone who has chronic conditions and who is a mother and wants to protect not only my family, but my community as well. So it was a few weeks ago when I went to the SOMO site on Jersey Street to receive my vaccination. I do just want to point out that Terry was absolutely amazing with being accommodating to senior citizens who were physically having some physical issues and maybe needed a chair to sit down. They couldn't wait on the line. So I really just want to make sure to let everyone know, if you need special accommodations or you're seeing a community member that might need special accommodations, let the site know. Can you bring out a chair here? Can I help you, move this way? And the sites will absolutely work with you. So I think that that's important to note. So I went in, I showed my ID, I had an appointment. Again, I met the criteria for vaccination. I was given the shot. It felt like a regular vaccination. I had some soreness in the arm. I did feel flushed and I had a headache. So instead of the regular 15-minute observation, I was feeling, I like to stay for a little more time to be monitored. So I stayed for 30 minutes. But I was able to go to work the next day and I didn't have any severe reactions from the vaccine. So my second shot is February 8th, I believe. And that additional and really just encouraging community members to access reliable information, connect with CBOs that are doing the work, and really just encouraging everyone eligible to get the vaccination so we can really start to enter a post-pandemic. Thank you, Frank.
Thank you so much, Sarah. And we're just in the interest of time, we're going to make a quick adjustment. First of all, Dr. Ginny and Tina are doing a great job of answering questions in the chat. If you do have anything directed for Dr. Rosen, please feel to direct those directly to her. I will also mention that we'll follow up with updates of the Staten Island Stay Strong, Stay Safe campaign in our follow-up email. That was going to be my presentation, so we'll just include that in the follow-up so that we leave more time for community members to speak. We'll hear from Reverends Troya and Jackson next, just a few minutes each about your vaccine experiences, and much appreciated, everybody. Thanks again.
So I'll jump in with just giving you some community-based vaccine experience. We had a chance to as Sarah mentioned, at the Mount Sinai Community Enrichment Center 2 weeks ago, provide support to the effort through organizing the line and getting people signed up. We were able to sign up more than 30 immigrants, mostly from the Latino community, for that event. And in fact, Yesenia got her vaccine that day, one of the 2 days that was open, along with some other folks from La Colmena, thanks to the governor's office. But in addition to that, just this past weekend, we targeted seniors from the Black and Latino community on the North Shore of Staten Island reaching out to First Central, Brighton Heights, St. Philip's Baptist, Stapleton UAME, Olivet Presbyterian, Our Lady of Mount Carmel, El Centro's database of undocumented immigrants who were 65 and over, because it was a senior initiative in Christian Pentecostal Church, and to Senator Savina, Assemblyman Fall, and Councilmember Debbie Rose's lists, so that we're targeted to be able to be sure that we brought into the high school to get the vaccines those communities that have been most isolated and unable to connect into the vaccine. And I just apologize to Priscilla. There was a glitch in the computer and 30 names got kicked out. And at the end of the day, we got them back in. So I wanted to apologize for that error between Health and Hospitals and DOH. And I'm sorry for the inconvenience it cost your seniors at the Van Duzer Civic. Can I just yield my time to Richard Atuka from El Centro, who was involved both in setting up the community-based testing and the work being done in the vaccines in the African community. Richard, it's yours.
All right. I just want to thank everyone for the great work we're doing so far. I just like Reverend Troyer has said, at El Centro, we have been doing a lot to help the immigrant community. We were the first CBO to actually host community-based testing, where our clients were able to come in and have testing done free of charge for them. Most of them were able to come in and do it because they were very familiar with the environment, and I mean, they felt very safe. Most of them have don't have immigration status, so they could trust us for that initiative, and it was very effective. For 2 weeks, we tested 330 people at our Port Richmond site, and we were able to translate to them in the languages they understand, which is Spanish. We have a large clientele that speak mostly Spanish, so we had a lot of translators there that could also reach out to them and also find out whatever they needed to know about the testing and any other thing that we needed to find from them. We also gave grants to them. We also had a grant where we were able to provide some Metro cards to them so that they didn't have to go back home stranded and all that. So we were able to give them Metro cards. We were also able to give them food, and we distributed masks. We are one of the CBOs that have been given the opportunity to reach out with masks and hand sanitizers and all the PPEs that people need to stay safe. So we made sure that they had all that supply when they came to do their testing. And we also connected them to NYC Cares, because most of them don't have health insurance because of their immigration status. So that was another opportunity for us to reach out to them with health insurance that New York City is providing for them to take care of themselves. We had a large backyard space to be able to do our testing outside of the El Centro office at 260 Port Richmond Avenue. And we would be so glad to do it again because it was very, very successful. I also want to add that El Centro has given out over $600,000 in emergency funds to immigrant families affected by COVID. And that initiative has really gone a long way to help them out, to make sure that they have the funds they need at this time. Most of them are out of work because they don't have the documentation to find work at this point in time, and we know how it is. So that is cash assistance that came in very handy for them and their families to take care of their rent and food and take care of the children too. So that has been part of the things we've been doing so far. I also want to talk about the COVID testing and the COVID vaccines in the African communities, because I actually work a lot with the African communities, and I noticed that there's a lot of enthusiasm about getting tested and also getting the vaccines. They really are excited about it. We have been able to do a lot of testing within the African communities. We have them come to our food pantries at 514 Bay Street, the 10304 zip code. Just like Reverend Troyer said, we also go to the UAME church to reach out to them, and a lot of them, they have been able to get their COVID testing. We have a large African community there. Most of them speak English, but we also have the opportunity to reach out to them in the dialect that they would prefer. Most of them also want to hear us in their dialect, and I'm able to speak one or two of those dialects to be able to reach out to them, for those of them that do need it. But for the most part, most of them speak English and they understand it perfectly. They are okay taking the COVID test, which is good. The vaccines, the major problem we're having, it's just what it is, having appointments. We've had so many of them reach out to us, cry out to us. I mean, sometimes we even get them call us in the middle of the night, asking if we could get them to the next available slot for the next day. And we keep telling them that we'll do everything we can to make sure that they get the vaccines when we have the opportunity to get them an appointment. I'm glad to say that they really, really are looking forward to having to get the vaccines. They like the whole idea and they all want to stay safe and protect their families to the best way possible. And I think that's
Sorry. Thank you so much, Richard, for that. We just want to make sure that we get all of our speakers in. I want to turn now to Reverend Carolina. Are you on? Reverend Carolina, are you there?
He is, but he's muted. I'm sorry, Linda's speaking. So Reverend Carolina, I think you're muted.
Thanks, Linda.
Reverend Carolina, I see you talking, but I don't hear you.
Okay, let's, while we're waiting for Reverend Carolina, maybe the Imam, if the Imam is on the call, are you available?
Frank?
Yes.
It's Sharmila. While we're waiting for them to get on, I just thought I'd share my experience in helping my mom get an appointment and how smooth it went at Richmond University Medical Center. As everyone on this call knows, we have 2 hospitals on the island, and Rumsey, which is where one of our co-chairs, Tina Campbell, works, is providing, as she mentioned earlier, and I think she dropped the number in the box as well, vaccinations for the community. Of course, all the sites, as you've heard today, are challenged by supply, but I would encourage folks to keep, as Dr. Ginny and Tina have both indicated, keep trying. Information is being updated in some cases daily at some of these sites. And our experience at Richmond University Medical Center, I was able to take my mom, who I actually lived on the campus of Rumsey when I was young. And so it was a really meaningful experience to go and to have it be run so smoothly, and the way that they cared for mostly the elderly that, as many of you know, are priority right now, was an experience that we were all nervous about. And I think it feels like she's ready to go back and to be at a place that really took the flow and the concerns of those coming. A lot of you have asked about social distancing and how do I stay safe, and it's cold outside. Many of our sites are aware of this. If you have concerns, I encourage you to let some of our community organizations that are active in this know about your concerns. They're all trying very hard to make sure that they create a comfortable space for you to wait and not wait too long. I've been very excited to hear that some of you have had positive experiences. Let us know both. We're trying to do the best that we can.
I think we have Reverend Carolina with us now.
I don't know. Can you hear me?
We can.
Yay!
Yeah.
Alrighty. I had to get off and go back on, but very quickly, in the interest of time, just want to thank everyone again for the wonderful meeting today and the collaboration that we've experienced. I know I'm supposed to be talking about my own experiences with the vaccine. I will tell you that I was supposed to get the vaccine this morning at Harlem Hospital, along with Reverend Al Sharpton and Calvin Butts and a number of other pastors. Needless to say, that did not occur because of the weather, but I can say that we've had a wonderful experience on Staten Island with collaboration, which is always key, because the greatest interest is making certain that folks get vaccinated. I want to thank Reverend Terry Troyer, certainly thank Dr. Ginny from the Borough President's Office. And I just want you to know I really appreciate what Jacinia said earlier with La Colmena about the importance of those communities who are underrepresented getting exposure both to information as well as to the vaccine. We are tier 2, so we've been able to provide PPEs and information to various communities, both the African diaspora community as well as African American community, a large Latino population, Park Hill, Stapleton, Mariners Harbor, West Brighton, New Brighton areas. We've given over thousands and thousands of PPEs, and we've been to probably 10 different food pantries. And again, anyone who likes to collaborate, continue to do so. We are here. We're at the Central Family Life Center, 59 Wright Street. I'm talking fast because I know time is of the essence. And so again, we would love to continue to collaborate with everyone because we are one family. Thank you so much. Keep up the great work. Stay safe.
Thank you, Reverend Carolina. And to all of our speakers, please feel free to send me an email if you would like us to share anything in the follow-up email. Thank you so much. Reverend Jackson, I want to make sure that we get to you.
Sure, I'll just briefly share my own experience with getting the first dose of the Pfizer vaccine, because my experience was one of ease, but there's something telling in that, because I was eligible through my employer. I have a computer with Wi-Fi access at home. I was able to navigate the 3 different appointment systems to be on the lookout for available appointments. I'm an English-speaking white woman who has never had a reason to suspect that the healthcare sector would not give me proper care or information. I've never had a lapse in my health insurance. I drove to my appointment with a car, and I don't have any mobility issues, and I'm not disabled. But then I think of so many of my neighbors, seniors who are really desperate to get the vaccine, who might have a disability, who can't drive, it'll be a challenge to get transportation, who don't have computer access or literacy, who don't have health insurance, who aren't eligible to have health insurance because of their citizenship status, who don't speak English. So comparing my experience to many of my neighbors, no wonder we're hearing on the news this morning that white New Yorkers have received the vaccine at 3 times the rate of Black and Hispanic New Yorkers. And I think that underscores the need that many of the other speakers have already touched on for the city to partner as deeply as possible and to resource community-based organizations that have that reach, that have those relationships, who can provide the transportation, the direction, the appointment scheduling to vulnerable, non-English speaking and uninsured communities. So when the city gave us those 400 appointment slots to fill for the point of distribution this weekend at Port Richmond High School, we were able to prioritize our undocumented neighbors who live in Port Richmond and who only can get the vaccine through an H&H distribution, and our senior clients who would typically be the last to get an open appointment slot. And I do hope to see more of this kind of collaboration between the city and community-based organizations in the future.
Thank you, Reverend Jackson. And thank you to all of our speakers. We're going to turn the remaining minutes that we have into a Q&A session. So we have Dr. Ginny and Tina here as well. They're both co-chairs for the Staten Island COAD and the medical ecosystem, as well as Dr. Ginny works at the Office of the Borough President and Tina works at RUMC. So just thank you both for your organizations and everything that you've done for them in the Staten Island community. I'm not sure if Dr. Rosen is still on here. So if anyone has questions for her or Dr. Ginny or Tina or any of our speakers, please feel free to direct them in the chat box and we'll field those for you.
Someone that can answer.
And also I should mention, if Sharmila and Linda, if you see any questions that might stand out to you, feel free to jump in with those. I'm gonna browse the chat box here.
Tina and I've been trying to answer a lot of the questions that have come up in the chat. Linda, if there are others that we haven't yet been able to answer, feel free to read those out. And as we're waiting, I really want to say kudos to Reverend Jackson, Reverend Troya, for mobilizing this weekend and getting their seniors to get these vaccines at the hub. And you're so right, Reverend Jackson. It is the volunteering of people like you that will eventually allow us to get to these really hard to reach areas of the community. And so the more we keep working with our health department and H&H partners, the more seamless and easy it'll get. And I think as people watch others in the community, and for whatever it's worth, physicians claim that they're scientists. So obviously all of us have been looking closely at the data, and I would say 93 to 95% of physicians that have been offered the vaccine, regardless of what background they're from, have actually accepted the vaccine. And so many are trying to help community members understand and educate them, and we're all here to help in whatever way whatever way needed.
Thank you, Dr. Ginny. I see that Bob and Lois have their hand raised. While we have the time, feel free to share.
Okay. We've been able to get our vaccines through the Brooklyn VA, the veteran. My husband's a National Guard, 27 years, and that went very smoothly. But the overall concern I have is that most people have been spending days on the phone, days, literally plugging themselves in and sitting there for hours to try to get through and not getting through, and getting on the sites, and they keep saying, no availability, not for just some hours, but literally days. A cousin of mine got through at 2 a.m. in the morning. So it's wonderful to say, just call up and make an appointment. It's still almost impossible unless you have an odd avenue like we did, and I think it's wonderful to address the Black, Latino, the other communities, and they need extra help, and I do understand that fully, but it's still, I think New York City flooded the availability too fast, and we're within the 65-year-old age. They didn't address 75 and older yet, or even all the community workers yet. I just think it was flooded too fast, and it made it very, very difficult. And unless you were lucky and you just walked in, like one of my friends walked into Rumsey at the end of the day, no appointment, but they got the vaccine. And I think that's great. They shouldn't be throwing it away.
Thank you.
It's just luck.
And that goes back to something that Dr. Ginny mentioned at the top of this town hall, that there are shortages, and we ask that everybody is patient. And also, I can pass this on to Tina Campbell over at Rumsey. They've been doing a phenomenal job with everything. So Tina, do you have anything?
So for the most part, you said luck, but it's really not luck. And what actually happened is that as I said, once we have exhausted, once we actually get, because our voice message allows us up to 200. After that 200, it stops recording. So we do keep those people on the list. And what happens is, once we get allocation, we literally individually call those people. And I can tell you this for sure, because I have individually called people to actually see if they can actually show up at a certain time. Now, you have to also remember something too. The eligibility, we have to go in the line. We have to follow the New York City and the New York State guidelines for eligibility. And what they tell us that we have to do first is phase 1A. We must do phase 1A before we have phase 1B. So if people are in phase 1B, but we do have somebody in phase 1A that came afterwards, we are required by the state to actually put the phase 1A before the phase 1B. So there's a lot of things that we literally have to go by, and we've actually signed attestation to say that we are actually going to follow the protocol of what the state suggests. Now, just going through the process, because there were a couple questions in the chat that people were not sure about, and I needed to make sure I explain. So once you get an appointment and we give you that appointment and you show up, security right away asks you if you have appointment and check your name to see if you're on the list. You're then brought to a seating area, waiting area, where your temperature is.
Excuse me, I'm sorry. I appreciate what you're saying, but this couple did not have an appointment. They were 65 and older, no unusual circumstances, and they walked up at the end of the day and got their vaccine. I'm glad they got it, but obviously it's not, protocol isn't always being followed. So
I don't know who you're referring to in specifically.
I don't say it to point a finger at anybody. Right. I'm just saying what everybody here in a position of authority, which is wonderful, what you're saying is happening isn't, oh, it's not always happening. It just isn't always happening.
Well, I don't know if the specific instances that you're talking about, but I do know for the ones that I am involved in, that is what we actually do. And your eligibility is first of all, we do not take anyone who is not eligible. That's
You
on the
did.
bat.
They did, by the way. And that's okay. That's all I'm going to say.
If they're 65 and over,
Yes,
they are eligible.
they are 65 and older, but they had no appointment.
But
and you're saying you have to have an appointment.
But listen to what I just said. What I said is they're eligible. We do not vaccinate people who are not eligible. So they are eligible.
I haven't heard of that. I appreciate that.
Okay. Now, just going back to the other piece that people are wondering about, we do have social distancing within that location as well, and we do temperature check, and you're given your forms to be completed. We also have an area where we keep people for that 15 minutes observation period, and every inoculator is certified and have the license to actually be able to inoculate. And the entire process from start to finish, we actually walk the person through, we walk each person through the entire process and provide follow-up for the second dose for them to return to the same site at whatever the time that they're given.
Are you finished?
Yeah, so
Yes.
I just wanted to jump in there. Thank you, Tina, for those final remarks. Thank you to all of our speakers and for everybody that joined us on this call. Really, this was just an excellent.
Imam, did you just join us?
I've been here all along, but I've tried to listen more than speak.
Oh, there you are. Okay, if you have some final thoughts to leave us on.
Yes, well, I'm 69, and I have the other illnesses that go with age, and I decided to take the vaccine. However, it's so complicated until even today. I called the center and still have not gotten an appointment. However, the appointments and the dates, and clergy should also be on the front line to receive the vaccines as well. Clergy, that's not in the format. However, I do support getting the vaccine in spite of a lot of the conspiracy theories of what my people have gone through with the different experiments and lack of medical treatment and etc. I'm just the opposite of what Reverend Karen Jackson indicated, that she was a white woman, didn't have to worry about having maltreatment and medical procedures, etc. So I'm a Black man and I'm skeptical. However, based on my religious beliefs and the scientific information from the professionals, there's a certain trust that I've had to develop in order to receive it. But I can only speak for myself. And even today, I have not received an appointment. So it's even confusing sitting on here, because things flash and then before I can note it, it's gone. I know Project Hospitality and Rumsey and SIUH, which wasn't mentioned, but I know that there's a lot of places that are distributing the vaccines and that you can get an appointment. But elders like myself, or people in general, it seems too complicated and confusing just to get an appointment, or less long, like Ginny said. Sometimes it might not have been the rule, but things happen and people can walk up. Maybe, and this person did walk up and got a treatment. Maybe it wasn't supposed to happen, but it did happen. And you have other people who's trying to get the appointments, but have no idea of how to proceed in order to get the appointment for the vaccine. So I just want to say that I think that as we go along, it should be made less confusing, less complicated. And if the vaccines are available, you should distribute, I would hope that they would distribute those who can come and get it, make it simpler, make it easier to obtain. And thank God for everyone that's working towards fighting or combating this virus. God bless you all. Thank you.
Thank you all. I know that we're short on time. We just have a few more things to cover. I see that Dr. Jill Cornell has her hand raised. Please.
Ooh, doctor, fabulous. I'm not a doctor, but I just want to share a Zoom trick because people are mentioning how fast the information is going in the chat. I experienced that too. I can't copy and paste that stuff fast enough. If you go to the bottom right hand of your screen, you'll see a little box that has 3 dots. When you click on the box, it says save chat. I do this all the time. And that's how I can able to go back and read the excellent comments that people are putting in chat. That's what I'm going to do with this chat too. And you click on that, and I'm using a Mac, and I get a little window that tells me that where the document is, and then I can save it into other locations. So don't torture yourself by trying to remember it. Also remember that Frank is going to send up all the links that get thrown into the chat. You're going to get in a follow-up email. So if you feel frustrated that you can't see all the things or access it all quickly, you're not alone. We're with you, but Frank's got you covered. Sharmila's got you covered, or you can also download the chat.
Thank you so much, Jill. With that, I know we're 5 minutes over. Did we have any final remarks? Sharmila, Dr. Ginny, Tina?
I will.
Ginny, I think Dr. Ginny and Tina should close us out with some positive yes about where we are and what's going on. But I do want to echo what Dr. Ginny and Tina have said in the chat, that our steering committee, our leadership, our members, many of us sit on advisory boards and multiple task forces at the city and state level. And so your concerns, your voices today in the chat box, what you've emailed and texted us, are being elevated to the city. Please be sure that we are here to represent your voices and your experiences to those powers and voices that are above. Every week, almost every day, all 5 of us are on calls with the city and the state. And so we continue to advocate for Staten Islanders, for Staten Island, for our health, wellness, and safety. And so we thank you for being patient. We thank you for being our partners. We thank you for leading in your own communities and sharing this information that we continue to inundate you with your friends, family, and neighbors. We fully recognize how challenging it has been. And I want you to know that we are here for you, and we continue to keep trying to get you the information you need, as well as amplify your voices of concern to those that can make change. With that, I would like to give Dr. Ginny and Tina some time to share their thoughts and comments on what else is happening here. Oh,
Covered.
You're on mute. There we go.
Thank you, Sharmila. I think you covered most of what our sentiments are. I know, I just want to say we understand it's been a very, very difficult past 10 months. All of us are in pain, we're hurting. It's been incredibly hard for us to see all the suffering and firsthand. Sharmila is 100% right. We are here to support you all, our community. The beauty is we're such a small community, and everybody is working so hard, so passionate, and there's lots of voices advocating, and our city and state partners have also been wonderful in listening to everything we've brought to them. So please be patient. I want to leave you with one thought. I know every day may not be good, particularly these days, but there's always something good in every day. So look for that silver lining, look for that little something good in your day. Don't lose hope. We certainly have light at the end of this tunnel, and the light gets stronger and we get closer to that light every day. But if you start to panic, if you don't really pull that inner strength and that patience, it's going to do nothing but make you anxious and frustrated. So hang in there and we'll get this done together. Thanks so much. And thank you all for being here and joining.
Thanks, everyone.
Thanks, everyone. Bye.
Thank you.
Thank you all.
Thank you and God bless.